Welcome, everyone. We're so glad you've joined today's National Lupus and You webinar. I am Wendy Rogers. I'm the Director of the Care and Support Services Department, and tonight we're so excited to explore living with intention and aging with purpose. People with lupus can live long, full, vibrant lives. And so tonight we're going to share two inspiring journeys. We're going to explore lupus across the lifespan, and we're going to offer tips for aging well. Here's tonight's agenda. We have some amazing speakers and panelists for you tonight. We're so glad and honored to welcome Dr. Stu Manzi, Dr. Sarah Lieber, Cherie Perron, lupus warrior and advocate, and Victor Church-Surya, also a lupus warrior and advocate for us. Before we begin, I would love to share some housekeeping details that should make life easier for all of us. To submit general questions for our speakers, please use the Q&A function, which is located at the bottom of your screen. If you wish to remain anonymous, simply select the anonymous option when you submit your question. We have set aside some time at the conclusion of the session for our speakers to address audience questions. We have some that our members and community have submitted, so we'll get to as many as possible. Don't fret, because we could reach out to you individually as well after this session. And for more specific and personal inquiries, please contact our health education specialist directly. You can do so at lupus.org/health educator. As a general reminder, please remember that this content that's shared today is for educational and informational purposes only. Please, please, please consult your doctor or healthcare provider before making any changes in your care. Don't forget, you will be able to rewatch this as we are recording, and the recording will be available and live on our website at lupus.org/lupusandU. Okay, so let's get into the first of our three polls. We love to hear from our community. You should have seen a prompt pop up, and I'm going to read the first question. Have you changed any part of your lifestyle as you've gotten older with lupus? The answers are yes, significantly, yes, a little, not yet, but I'm planning to, and then no changes so far. Okay, we see it slowing down. All right, let's close it out and see what the results are. All right, here's the results. So we have 44% of you that say yes, significantly, and then 37% of you said yes, a little. 8% said not yet, but I'm planning to. You're in a great place right now. And then no changes so far with 12%. Thank you so much for sharing that. So we see this as a pertinent topic. So for those of you who may be new to our organization, we just want to share a little bit about us and some of our programs and services that you can use. Our vision and mission are very simple. The vision is simply to end the suffering of lupus while providing support for people that need it right now, today. For over 40 years, we've been dedicated to serving the diverse needs of all people with lupus. Thanks to progress we've championed, people with lupus are living longer, healthier lives. We remain committed to helping you navigate lupus today while working toward a future without lupus. Our programs rest on three pillars: research, care and support, and advocacy. We're redefining lupus research, not just by funding grants, but by bringing together all stakeholders to break down barriers and accelerate the progress. At the same time, we provide compassionate support to those impacted by lupus, and we lead advocacy efforts to secure more funding for vital services. So together, these efforts are driving meaningful change and hope for this community. People with lupus truly, truly are the heart and soul of our organization. Every story, Every challenge, every triumph of people who are living with lupus really does fuel our mission and our work. And you truly do matter. And so I'd like to share some resources that you can incorporate into your personal self-care. The first resource I'd like to highlight is called SELF, which stands for Strategies to Embrace Living with Life Fearlessly, or SELF. This is an app. You can find it and download it in the Apple App Store or in your Google Play Store, depending on which type of smart device you have. This is a free self-care program for people who live with lupus, and you'll find some great tools in there that can be customized to your own personal journey. Next, I'd like to highlight our amazing team, not just because they are on my team, but the health education specialists or certified health specialists that are truly and specially trained to provide people with lupus free non-medical support, disease education, and great resources for the journey. They have helped individuals and family literally around the globe. To date, they have worked with people that have been impacted with lupus in over 67 countries. To connect with one of our amazing specialists, please visit lupus.org/health educator and fill out the online form. Or you can call the 1-800 number listed here, 1-800-558-0121, extension 136. We also have a QR code there for you to learn more and explore. You can scan that now. Did you know we have support groups, and our organization offers both national and regional lupus support groups. These groups are also available in person and online. Please consider connecting, sharing, and finding support where you are. Now we have it at the fingertips, so a lot of times you can join multiple groups. You can scan this QR code to register for a group or a session, or email one of our trained facilitators. You can also go to our website at lupus.org, local support, to find a group near you. Please get involved with us. We are a multifaceted organization. We would love to have you and your talents and your voice. Stay connected with us. You can join a support group. You can volunteer. You can advocate. Please visit lupus.org to get involved. It's walk season here at the Lupus Foundation of America. You might have received an email or you know about it. You might even be a walker. The Lupus Foundation of America hosts over 40 events in cities around the country. We also have a virtual walk that you can join. To find a local walk, go to walktoendlupusnow.org and get involved. Don't forget to wear your purple and invite your friends and family. Okay, let's do our second poll. Let's hear your thoughts and see what you think. Okay, here's the question. Do you feel your health provider talks enough about age-related needs in lupus care? The answers are yes, absolutely. Somewhat. Not really, not at all. I'm not sure. Okay, let's see the results. They're slowing down, slowing down. All right, here's the results. Wow. 42% of you said not really, which is a great way to have this discussion and reason to have this discussion. 33% say not at all. And then we see 16% follow with somewhat, and then not sure, and then yes, absolutely. So shout out to all the doctors that are having these conversations and health providers. All right, let's get to our speakers. We're going to start off now with our Lupus Warrior panel discussion, and I'm very, very excited to introduce two amazing people. I'm excited to introduce Cherie Perrone. She is a longtime volunteer with the Lupus Foundation of America since 2001. She served in many roles through her years working with the organization. She served 2 3-year terms as chair of the board of directors for the Philadelphia State Chapter, shout out to Philly, and most recently served 6 years on the National Board of Directors as the National Council Representative. Cherie has been living with lupus for over 30 years and is an outspoken advocate for raising awareness of lupus through our programs Research Accelerated by You, also known as RAY, and our Lupus Research Action Network, also known as LRAN. We also have joining with us Victor Church-Surya, who was diagnosed with SLE at the age of 13. He was in the 7th grade. He has been living with lupus for 36 years. He was born in Bangkok, Thailand, and grew up in Cerritos, California. He attended UCLA, Go Bruins, and has a BS in mathematics. Currently, Victor lives in Simi Valley, California, and he works at Anthem as a business analyst in the Medicaid division. He's worked there for 25 years. In Victor's spare time, he enjoys traveling, attending musical shows and ABBA concerts, skiing, doing trampoline and tumbling workouts, watching gymnastics, and going to theme parks. So as we can see, welcome, Cherie and Victor. You both are living very fruitful, active lives. And so let's have a little discussion about that. You can come on camera. Hi, Cherie.
Hello.
It won't let me come on camera.
Okay, no problem. We can see your screen, your profile. So we know a little bit about, there you are.
Oh,
There
okay.
you are. We know now about when you were diagnosed or how long you've been living with lupus, which is phenomenal in itself. And I would love to start off thinking about your diagnosis and early years of lupus. When you were diagnosed with lupus, was your diagnosis process difficult or did it take a long period of time to do so? What was this process like? Let's start with Cherie and then we'll go to Victor.
It actually took over 6 years for me to get an accurate diagnosis. I had seen at least 5 different doctors that told me it was in my head, that I was making a story up because I wanted to go on vacation or just not work. I was told that I had cancer. It was just awful. It was an awful, awful experience. And it took over 6 years to be accurately diagnosed. And when I finally found a rheumatologist, or finally was directed to a rheumatologist, he reassured me that he was going to stay with me long enough to find out what was going on. He believed me and he believed my symptoms. So, in spite of all of that, I finally got an accurate diagnosis, but I must go on to say I was in denial for a few years afterwards, just not wanting to accept it.
Wow. So you really do fit that average time frame we have for 6 years. And I'm so sorry to hear that. Victor, what was your diagnosis experience?
Well, it was actually in the spring of 1989. I was as you said, I was 13 years old in the 7th grade. And I think around March of that year, I started getting butterfly rash and rash all over my body. And since I was 13, my parents, but especially my mom, took me to the doctors. And, we started, going to the like the PCP first, and then they recommend us go to see a rheumatologist, and we went to an adult rheumatologist. I mean, I was 13 years old, but I went to an adult rheumatologist, and pretty much within a month of when I got the rash, like maybe in April of that year, I was diagnosed with lupus. He said that I might have lupus, and then he did some blood tests and confirmed, from a blood test that I had lupus. So I pretty much knew within a month. And then
Oh, okay.
and because of that year, I was going through a lot of different illnesses. I ended up missing the last 6 weeks or two months of school, for the rest of the school year, in May.
Wow. So we see we have you at different spectrums, which we know people can fall anywhere with their diagnosis experience from long to short. And so when we think about your journey after diagnosis, let's think about the medications and treatments. Have your medications or treatments changed over the years? And if so, how have you handled these changes?
My medications have definitely changed. In the very beginning, I hate to say just steroids, but in light of the medications that we have now, I was able probably for about 5 years to just have my lupus maintained with steroids. But what
Okay.
I noticed that as my lupus got more severe, and various organs became involved in it, my medications changed. And it was a challenge to find the right medication because I was allergic or had allergic reactions to some
Oh.
of the, I think, normal medications that people are given.
Mm-hmm.
So it was a challenge with the medications just in and of itself. I have
Okay.
had Rituxan, I've had Cytoxan. I can't take methotrexate. I can't do Plaquenil. So those, and some of the other drugs that are, Benlysta, can't do that either. So it's been a challenge, but the medications have gotten stronger as the dose of steroids has increased as a result of the severity of my lupus.
Okay, so you're saying that your steroids have kind of gone down in the with the other?
It it varies.
Okay.
Yeah, like with the Cytoxan, the steroid dose is usually lower.
Okay, I get you. I get you. Victor, what has your experience been with the medications over time? And
Well, when
how
I
have
was,
you changed it?
yeah, when I was, I guess, a teenager, I was on regularly on methylprednisolone, which is kind of like the prednisone for children at the
Okay.
time. They maybe like, the short version is called Medrol. So I was on
Mm-hmm.
Medrol. I was also on Plaquenil and
Okay.
Jefferson, and but I'm no longer on those three medications. But instead of Medrol, I'm now on just the regular prednisone, and then
Okay.
and now I'm on like kind of like Cellcept, mycophenolate, and
Mm-hmm.
Linus. I used to be on Imuran, so yeah, it has shifted over the years.
Okay. And then when you think about we all have our ologists, for living with lupus. I'm also a lupus warrior, so that's why I say we. But when you think about working with the different doctors and care teams over the years, what has this been like? I know it's often devastating to retire someone or find someone who believes you or talks to you. What's that experience been over the years for you? Cherie, we can start with you.
Well, it took me about 7 years for me to get my team of doctors together.
Wow.
And it was because at that point, when I was newly diagnosed, I could not find a rheumatologist here in the Philadelphia area that did not know more about lupus than I did. I did my research, I had never heard of it. So I really jumped in with both feet to find out what was going on. So I
Mhm.
ended up at Johns Hopkins. And I
Okay.
was at Johns Hopkins for about, I don't know, maybe 5 to 10 years after my initial diagnosis. And I really first severe lupus flare. And then the physician there told me I really needed to find doctors in Philadelphia. And
Okay.
it took me 7 years. And unfortunately, as we age, so do our doctors. And quite
Yes.
honestly, I never thought about that. I mean, it just wasn't in the forefront of my mind. So in June, I had two doctors retire. My rheumatologist that I've been with for 20 years retired, and my
Hmm.
nephrologist, that's, I guess I've been with him about 15 years retired. So I feel like I have to start all over again developing these relationships. And
Hmm.
it's tough. And at one point, while looking for a rheumatologist, I found one that I thought would really be a good fit, only to find out she was part-time. And that was
Oh,
not going to work for me. She had a set
oh,
schedule and
yeah.
it was just that. And that was like, that's not going to work. Thank you, but no thank you. I had to find someone else.
Okay. Victor, what was it like for you with working with the
Well, when I was
medication?
younger as a teenager, I would I was getting treatment from the Children's Hospital of Orange County, and there was like a network of, rheumatologists and other specialists. So they were all in the same, pretty much not, if not the same building, but maybe the same complex. So
Okay.
it was kind of easier to do it that way. But I was also younger, so I didn't really manage all these
Yeah.
appointments. I had my mom try to do it. but now
Hmm.
that I'm older, I had to, the shift is that now I go to like different specialists, not just a rheumatologist. I go to a nephrologist, a
Hmm.
cardiologist, and they're not all in the same location. And I think that because they're in different location, communication between the different doctors is a little bit less frequent than when I was
Mm.
yeah, a teenager at the Children's Hospital of Orange County.
Mm. I could see that, and I know the transition from pediatric care to adult care can be stressful too. Did you feel that way as you made that change?
Yes,
Breaking.
it was a big shift. It
Okay.
was a big shift when I turned 21 and I had to leave the children's hospital and then go from the pediatric rheumatologist to the adult rheumatologist because the the children's um, rheumatologists they not only just provided care, but they also provided emotional support, social
Yeah.
worker. There was this whole social worker network as well.
Hmm.
But as an adult, you're kind of just left on your own to deal with
Yeah.
all.
Yeah, I could see that. I could
Yeah.
see that. Thank you for sharing that. So let's jump to thinking about homework and family. And Cherie, I want to hone in on you because I know you're a mom and a wife and all that good stuff. Has your role in your family changed over time as either as a parent, a partner, a caregiver? What's that been like?
It definitely has changed. I am, I'll say, my care partner is my husband. So
Hmm.
he is my primary go-to person, but my role has changed because my mom got sick. And
Hmm.
when my mom got sick, I became the caregiver for my mom. It was difficult and a challenge because my mom lived in Atlanta. So I was
Oh,
away from home for an entire month and periodically for years taking care of my mom. But
okay.
my mom died in February of this year.
Yes, I'm so
And
sorry for your loss.
not too long after that, my father began to have health issues. So he is now living in a veteran's home. So I'm trying to care for him. My husband and my mother-in-law relocated from San Antonio, Texas to here in Philadelphia. So
Okay.
I'm trying to support my husband as he cares for his mom, who's living alone at 86 years old.
Oh my
And my
goodness.
dad is 90, living at the veterans home. So my role is now a caregiver of my father and assisting my husband. My husband's role is a caregiver of me, trying to care for his mom. We have adult children, so they try and jump in as often as they can, but it's a challenge to just manage all of this because I feel kind of like that sandwich generation. I don't
Mm-hmm.
have grandchildren, praying someday to have them, but I don't have grandchildren, but I have an older parent and parent-in-law that I have to take care of. So it
Mm-hmm.
has definitely changed, and it's a challenge, big
Mm-hmm.
challenge.
Can you speak to, because I know we have young parents on here, and that's been a voice that's been rising in our community about parenting with lupus. What was it like, or what's one big change you noticed from having, being a parent with younger kids versus now with managing lupus?
Actually, it's gotten easier now.
Okay.
It's much easier now because I'm not parenting.
Mm-hmm.
Um, the roles have reversed because they
Okay.
definitely will tell me, I don't think you need to be doing that. You need to go to bed, or
They
where do
become
you
your
think you're
parent.
going?
Yeah.
Oh, they have definitely become my parent.
Okay.
Absolutely. But
Okay.
it's gotten easier because I'm not the one providing the care for them any longer or running around behind them any longer.
Okay. So let's jump into communication because talking to people about lupus can be quite challenging. And I'm really curious about, this process of aging with lupus. Have you found that your ability to explain lupus or set boundaries with people in your life got easier over time? And if so, what would you suggest to people? Either one of
Um,
you. Victor, let's start with
I,
you.
I would say that when before when I was younger, I would be pretty much closed-minded. I didn't really share my lupus with anyone.
Oh,
I
okay.
yeah, I would, I would just, I would just keep everything to myself, and but now I'm more open-minded. I'm willing to share and share, and willing to listen to other people's stories. Uh,
Okay.
so I think there's a lot you can learn from everyone's stories, everyone's experience. So
Hmm.
I'm more open-minded and willing to share and not be just so closed-minded.
Okay. Cherie, what about you?
I have found it's easier for me to set boundaries as I've gotten older. I had a very difficult time years ago saying no. I just thought it was, I guess I grew up in the generation where you don't say no. You're just
Okay.
supposed to be accommodating and a quote
Hmm.
unquote people pleaser. So I have found that it's a lot easier for me now to say no, and especially setting boundaries within my family and my extended family, because
Okay.
they now see the results of me not setting boundaries. They
Okay.
see what happens when I push myself, try to push through something. And I don't do it anymore. I just said, no, I'm not going to do that. I don't have the strength, I don't have the energy, and I'm just not going to do it. I
Okay.
do still find communication with my friends difficult because we
Oh,
may make plans to go out or have a spa day, and I may call that morning and say, ladies, I can't do it. I'm going to be
okay.
in bed all day. And
Okay.
that is still a challenge.
Okay. So thinking about that, I want to touch on support before we close this out. And Victor, I'd like to focus in on you. Have you found that the type of support you need has changed over your life, especially as a man?
Uh, um, I I mean, I think that well, as I said in the last statement, that I'm a little bit more open-minded in asking for support. I mean, listening to other stories.
Hmm.
So I would say that uh, yeah, I mean, it's probably good for me and for everyone, especially a man, to be more to express your feelings more and even and be emotion and be more vulnerable emotionally. So I feel that I probably need more of that emotional support.
Okay. So your final thought before we move on, if someone with lupus asks you for advice about getting older with lupus, what would you tell them? Victor.
Okay. Okay, well, I'll give like three advice. The first one is, I guess, know your bodies and your body's limits, and and know when to say no. Learn to say no to people, based on your body's limits. And then number two, I would say, number two, second advice I would give is, I learn as I get older that not don't take life too seriously. I know things are not going to go your way all the time, but you know, I try not to take anything, any setbacks too seriously. I mean, I recently had a setback, but I wasn't all. I used to be all emotional about it and cry about it, but I kind of don't really take it too seriously. As long as you wake up and you're able to get out of bed, I consider that a success. Um,
Wow.
and then number three, what I learned recently is, learn to ask for help when you need it.
Mm,
You know, don't think that you can do everything on your own or be shy about it. Ask for help, whether it's physical help, from a doctor, or financial help from a family member or friends. Make sure you ask for help because you can't do everything on your own. I mean, when you get older, you have limits, so you need help sometimes.
okay. Excellent advice. Cherie, what about you? What would you tell someone?
I'm going to be like Victor with three points. I'm going to say to find three people. The first person is somebody that's newly diagnosed that may be scared or frightened and not know what to expect. I would say find that person and walk with them through their journey of lupus and be that, I'll say, shining light for them. The second one is to find somebody that's where you are, somebody that's kind of
Mm,
on the equivalent level of where you are, so the two of you can walk together through, hey, this is what my doctor said, or this is what I'm experiencing, or, let's just get together and talk and compare minds and compare stories, which are so very important. And then the third one is to find somebody, if you can, who's been living with lupus longer than you have, so that you have hope and encouragement of, like Victor said, it's not that bad. It's not that serious. You wake up in the morning, you be grateful
mhm.
for it, but find somebody that's kind of been where you're going, so to say. So, and just know that you're not alone. That's the most
Wow.
important thing, because lupus can be so very isolating.
Yes. Beautiful advice, you two. Thank you so much for being vulnerable and open about this. I'm sure this has touched someone. It's touched me. And I appreciate all you do and continue to do. And thank you for your time. Thank
Thank
you.
you for having us.
Thank you. Thank you for having me.
Okay, so now we're going to take our third poll and we'll move into our next speakers. Okay, look for the prompt. All right, do you feel your healthcare provider? Oh, that's the wrong one. Okay, here it is. What does healthy aging mean for you? Staying physically active, maintaining independence, managing lupus symptoms effectively, staying mentally and emotionally well, all the above, or something else other? Okay, looks like we are at close. Let's see the results. Okay, so we have 2% of you that say physically active, 2% maintaining independence, 2% for lupus symptoms management, 4% for mental and emotional wellness, but 90% of you say that it's all of the above, and I could probably agree with that. So thank you all for sharing that, and nobody thinks other. So thank you for your thoughts. I know this is going to be very insightful for our speakers as they come to us now. Okay, so now I am very, very excited and humbled to introduce to you Dr. Sue Manzi. She is the medical director for the Lupus Foundation of America. She served as board chair from June 2018 to June 2021. Dr. Manzi is currently professor of medicine and chair of the Medicine Institute at Allegheny Health Network in Pittsburgh, Pennsylvania. She also serves as director of the Lupus Center of Excellence in the Autoimmunity Institute. Dr. Manzi received her MD from the University of Pittsburgh School of Medicine. She completed her medical internship and residency at Duke University, then returned to Pittsburgh where she completed her fellowship in rheumatology and received her master's of public health from the University of Pittsburgh. Dr. Manzi is recognized as an outcomes and translational investigator focused on cardiovascular disease and systemic lupus erythematosus and in the discovery of biomarkers for lupus diagnosis, monitoring, and stratification. She has published over 250 scientific reports and book chapters and is the inventor of the cell-bound complement activation products called CB-CAPS technology platform, for which she holds more than 20 patents. Wow. The CB-CAPS technology has been licensed by Exogen Incorporated and is now available across the country to enhance diagnosis of lupus. Her research program has received multiple multi-million dollars in support from many organizations, including the NIH and the Department of Defense. Dr. Manzi has served on advisory boards for the FDA and more than 20 pharmaceutical and biotech companies, and has chaired or served on numerous NIH study sections and data safety monitoring boards. She has sponsored more than 100 graduate and postgraduate trainees and was recognized by the NIH for her excellence in mentoring, which I think is absolutely beautiful, not only to be so brilliant, but to teach others and help them along the way. So welcome, Dr. Manzi. You now have the floor.
Thank you, Wendy. Honestly, I don't know where you got that long introduction. You could have just said a rheumatologist in Pittsburgh, and that would have been good. But anyway, listen, I'm going to share my screen here. And while I'm doing that, I have to say that, let's see here, hopefully I can share my screen. Can you see the screen?
Yes, yes, we
Okay.
can see it.
Okay, good. But anyway, it was so good hearing the first panelist, because I think everything they said is something we hear as physicians all of the time. So true, and their advice was right on. So I can't say enough. And I have to say, they're both living examples of how you can live the lifespan with lupus. So I think if there's anything you get out of this whole webinar this evening, it is that you can live a full life and have a great life, even with the diagnosis of lupus. And there are obviously things you can do to make it better, but being here tonight, being on this webinar and having information is your best defense against fighting this disease, because information is powerful. So my job was to talk about lupus across the lifespan. So I'm going to do that by mixing a little bit of what we know about research in what happens to people with lupus over time. How is the disease different in children than adults? And but I want you to take the other thing you need to take home with you with this is what I'm going to show you is what research shows, what generalities are, because in the end, we always say lupus patients are like snowflakes. No two are alike. So everyone's experience can be a little bit different, right? So this is just to inform you and give you enough information so that you can take the best care of yourself as you live longer with this disease. So what are we going to talk about? Well, we're going to ask a couple questions, right? Are lupus patients living longer than they were 50 years ago? Is lupus different in childhood onset versus adult onset? Do symptoms of lupus improve with age? And does management of lupus change with aging? So we're going to try to tackle some of these questions. Well, the good news, I'm going to show you some information here. Let me get rid of this thing so I can see you all and move this. The good news is that yes, lupus has improved. The survival in lupus and mortality has decreased. And what's really interesting is that this is just looking at mortality in lupus over time since 1970 to the 2000s. And what you can see, which is interesting, is that a major drop in deaths related to lupus occurred at the time when many of these medications became available. Mycophenolate mofetil or Cellcept, rituximab, belimumab, or Benlysta. And you can imagine as more and more of these agents are coming in to the market, very good biologics like anifrolumab or Safnello, these kinds of curves continue to go down and survival continues to go up. So that's good news for us. Let's see. And so this shows the same thing. And I like this study. This was a combination of some data from 2016, but also 2021, where they looked at 900 people living with lupus. 400 of them developed lupus when they were a child or juvenile onset disease, and 51 were adult onset lupus. And what you can see is, again, if you look at mortality from 1950 going to the 2000s that it continued to go down, whether you were a child onset lupus or an adult onset lupus. As a group, mortality went down. That's a good thing. If you look at unexpected deaths related to lupus, and this is not surprising, the younger you are, this is age here, right? 0 to 10 years of age, 10 to 20 years of age. The unexpected deaths were higher because you don't expect a 10-year-old in the general population to die. But some young people with lupus, unfortunately, can die. So unexpected mortality is much higher. As you age, as we all age, right, death becomes more expected as you get older. And so unexpected deaths related to lupus go down. But the major point here is that overall people are living longer with lupus, and it showed over and over again in multiple studies. Probably because we are diagnosing lupus earlier, people are becoming aware of the disease, they're asking questions, could this be lupus? And our treatments have certainly improved. Now, when we look at what impacts mortality in lupus, a few things come out. One is greater use of steroids. You know, we're always on people to minimize prednisone or minimize Medrol because of all the other impacts that those medications can have. High blood pressure, they cause weight gain, they can cause bone thinning and fractures. So we try to minimize steroids, and a lot of the new medications are allowing us to do that. And also, interestingly, over and over again, we see that if you're able to take hydroxychloroquine or Plaquenil, some people cannot take it, and that's okay. But if you are, you seems to reduce mortality by at least 45%. And part of that is because Plaquenil or hydroxychloroquine has other benefits as well. It may prevent blood clotting, or it may have impacts on lowering cholesterol level or preventing diabetes, or lowering blood sugar levels. So there's added benefits to some of the medications we give that may be impacting what we're seeing in terms of improved survival. So is lupus different in childhood onset than adult onset? The answer is yes. It's likely different, and you can see, this is sort of lupus through the lifespan. You have a child here with a rash, a young adult, and even an older adult here, or mature onset. But how is it different? Well, this is a study that looked at the severity of lupus in people that had juvenile onset, childhood onset lupus, versus adolescent, versus an adult, or versus mature onset. And usually when we talk about mature onset lupus, it's after the menopause, so in the 50s, age 50 or older. And what you can see is if you look at kidney disease, you can see much more common in childhood, adolescence, than adult onset lupus, and much less common in mature onset lupus. And the juvenile onset or childhood onset overall had more kidney disease than adults. Now, you can see there are adults and older individuals who have kidney disease, but as a group, they tend to have less. Similarly with central nervous system disease or brain involvement, you can see again, childhood lupus tends to have more, and those that have lupus during childhood, onset of lupus during childhood, have more central nervous system disease than adults. And mature people with lupus tend to have significantly less brain involvement. So differences, right? And we've always thought that the younger you are, sometimes the more severe the disease can be at onset. And so we also think, okay, well, what does lupus look like in mature onset? So this is, again, generally people that are over 50 years of age. And if you look at it, often people at that age, when they present with lupus, they have other associated autoimmune diseases. And sometimes Sjogren's is a common one, very dry eyes, dry mouth. And associated with that, we'll sometimes see a positive rheumatoid factor in the blood when you're doing blood testing. They do have anti-nuclear antibodies, that's the ANA, but they tend to have a milder course overall when you develop lupus over the age of 50. When they do have active lupus symptoms, they tend to have more what we call serositis, which is inflammation around the lining of the lung and the heart, sometimes called pleurisy or pericarditis, tends to be seen more commonly in mature onset. And interestingly, you know, when we talk about most lupus patients are in childbearing age, right? Right after menses and before you go through the change of life or menopause, like 15 to, 45 or 50 is the peak onset. Usually the ratio of women to men is around 12 women for every one man. But in juvenile or childhood onset lupus, it's closer to 1 to 1. So boys and girls can get it commonly at the same frequency. And interestingly, in mature onset lupus, it also becomes closer men, women in terms of risk for lupus. The frequency, however, if you look at all of lupus patients in the world, the frequency of those that get lupus at mature ages, over 50, only represents a fraction of lupus patients. Probably, no, about 80 to 90% are not going to be mature onset lupus. They're going to be in that peak range that I mentioned. And do symptoms of lupus improve with age? This is a common question, and a lot of you have already raised this. I've lived with this disease for 30 years. And the good news is this. Now, again, everybody has a different story, that although premenopausal women with lupus have more disease activity than usually postmenopausal women with lupus, regardless of where you are in your lupus journey, there tends to be a constant rate of improvement over time, whether you're premenopausal, through the menopause, or later in life, the curves seem to show improvement. That's good news, right? And that's why mortality rates are falling. Again, it's from better lifestyle, treating other illnesses, right? Better diet. It's also better medications. We have better treatments. We're trying to reduce steroids more frequently. So lots of reasons we're seeing improvement overall over time. Now, how does aging quiet lupus? Because we do see that, right? People will be very active when they're a child and things tend to get better over time, or just generally, especially when you go through the menopause. And interestingly, there's been investigators at the University of California at San Francisco who've shown that when you're aging, you tend to turn down the activity of certain immune genes, which basically leads to fewer interferons. You've heard of interferon alpha, type 1 interferons, or inflammatory proteins in the body. And that's a good thing, right? So you're kind of shutting down those mechanisms of the immune system to not be producing so much of those inflammatory proteins. And that may be one reason. In addition, we know that there are hormonal impacts on our immune cells. And if you see here, estrogen and progesterone, both here, can impact B cells. And we know that B cells are a white blood cell that is very critical in lupus and are responsible for the formation of antibodies that attack self, and T cells, which also are important in regulating the immune system. So changes in hormones over the menopause, right, when those hormone levels tend to go down, may be one of the reasons we're impacting lower disease activity and milder course once you get to a certain age. But we have to remember, and this is a really important point, and I think people were asking this in the Q&A and I tried to answer it. Although lupus disease activity may quiet with age, we're aging, right? And with aging comes its own issues. And what gets hard with patients is teasing out what is aging and what should I be expecting and what is my lupus. And they kind of battle with this in their brains because it can be hard. Because as we age, what happens is our cells may become, our cells die and we form new cells all the time, right? Cells are dying, we're forming new cells. Or there may be damage to our genetic material in some of our cells, and we have to repair that. We have repair mechanisms to fix those cells and get them back to normal. As we age, those repair mechanisms tend to be less functional. And so we can't repair our damaged cells as easily as we could when we were younger. What that leads to are defects in our immune system. So our immune system becomes less active, if you will. Now, that's good for lupus, but that can be not so good for infections, our ability to fight an infection, which is why an 80-year-old that gets pneumonia, it's much more serious often than a 30-year-old that may get pneumonia. So aging can also make us less likely to respond to a vaccine, which might lead to more viral infections. We also, the longer we live, there's more environmental and emotional and psychological stresses, which can impact, how we age. So we have to remember that although lupus disease activity goes down, aging is happening, and there may be other things that we're going to have to battle or at least prevent and address to keep ourselves healthy through the lifespan. And so does management of lupus change, right, with aging? And the answer is yes, of course it does. And for several reasons it may. First of all, as we age, now not always, a lot of lupus patients at young ages are taking a whole lot of medicine, but it is more common for older adults to be taking many, many drugs because they have other comorbidities. They now have heart disease, or they may have lung issues, or they may have osteoporosis or other factors. So we have to be careful of the medications we're giving in terms of interactions with other drugs. In addition, there may be other comorbid conditions. So for example, if somebody has diabetes, we have to be careful giving steroids or prednisone. That may make their blood sugars go up or their blood pressure go up. So we have to adjust medications or be careful what we give and not give based on any other medical conditions that a patient may have with age. In addition, all of us, as we age, and hopefully will be healthy to the age of 100, we generally gradually lose some kidney function with aging. So you may have to make modifications in the medication dosage that we give for people that may have some mild kidney impairment, particularly that may happen even just with aging. Now, this is another important one, and I love the picture associated with this because lupus-like symptoms, just need this a minute, may increase with age, and I'm saying lupus-like symptoms may increase with age even if they're not due to lupus disease activity. What's a perfect example of that? Joint pain, right? And if you look at where this woman is pointing, you see, she's pointing to the base of her thumb. That is the most common area for osteoarthritis or degenerative arthritis, not lupus arthritis. This is an arthritis that happens in probably most of us as we age. You hear about it. Most people are going to get some form of degenerative arthritis. So when my patients come in and say, my lupus joints are acting up, and they point there, or a knee that cracks when they move their knee, it could be that they are now developing another form of arthritis. So we have to be careful what we blame joint pain on. Fatigue as well. Sometimes medications can cause fatigue. Sometimes when we go through menopause, our sleep is disturbed, right? We're not sleeping as well. That can cause fatigue or cognitive decline with aging, or chest pain could be from a variety of other issues. So again, we have to be careful what we attribute to lupus as we age. And then beyond lupus disease activity, so my job is not just to treat people's lupus disease activity when they're 20s, 30s, 40s, but I want to prevent any other kind of organ damage or comorbid disease that could occur. And many of them are more common in lupus. So we want to prevent heart disease. We want to be preventing cancer. strokes. We want to do everything we can to minimize Alzheimer's or diabetes or chronic kidney disease. So that takes a lot of attention as a physician to be preventing these things as well. So let's talk about your cerebrovascular system, your cardiovascular system. We all have to worry about that as we age, but lupus patients even more, because the risk of stroke is higher in lupus than expected. Now, again, if you look at by age, right? If you're less than 30, the unexpected, anything about, and I'm going to teach you something tonight. I know it's late and you're like, don't show me any graphs, but I'm going to teach you. When you see these dots and lines to the right of this line, that means it's more common in lupus than expected. When the dot is on the left side of this line, it means it's more common in non-lupus patients than in lupus patients. And you can see, no matter what age you are, coming the whole way down to greater than 70, everything is sort of clustered on the right side of this line, saying that there is a greater than expected risk of stroke. So we have to be very careful about monitoring blood pressure, making sure if you've got antiphospholipid antibodies, that we're careful about prevention, because there's a 2 to 3-fold overall increased risk. People ask all the time about dementia or cognitive impairment. This was a large population-based study that showed if you look at the onset or the risk of developing dementia, which is here, lupus patients develop it much more commonly, right, than non-lupus patients. So again, we think it's related to vascular disease from strokes or mini strokes that may be happening. So we need to have attention to our vascular health and our cardiovascular health. Heart disease, we know that it can occur in young people. This was a patient of mine who had a fatal heart attack at 27, but over the age, we all have higher risks of heart disease and heart attacks as we age. And in fact, lupus patients have higher. Remember, I told you any dot to the right of this line means that lupus patients have higher risk of heart attack than non-lupus. And you can see all this clustering here, because in fact, there's about a 2 to 10-fold increased risk of heart disease if you have lupus. So we have to be very careful about cholesterol management, blood pressure management, no smoking, keeping your weight as best you can, because we want you to stay heart healthy. And the risk of heart failure is also greater. And this is just a graph showing the increased risk of congestive heart failure, which is a heart issue. This is in men with lupus and women with lupus compared to men without lupus and women without lupus, higher rates. So heart health and prevention are important. And cancer risk. We have to be monitoring for cancer risk because there is a slight increase, about an 18% increased risk of cancer. And as we age, that becomes an issue as well. So lymphoma or myeloma, if you've heard of these, some other different cancers, bladder and thyroid, stomach and brain cancer may be slightly increased. Now, the good news is we tend to see less breast cancer or uterine cancer or melanoma or prostate cancer, maybe because we avoid hormones or other reasons. But again, all this is saying, not to scare you, but we need to have good preventive. You should be getting your colonoscopies, getting your mammograms, even though risk may be slightly lower, getting your thyroid checked by your doctor. These are the kinds of things that we need to do to keep you healthy through the lifespan. And then bone risk, right? Steroids are a big factor here, but lupus patients tend to have more bone fractures, more osteoporosis, and you can see how this bone is becoming more fragile with age, right? And that happens with aging and definitely through menopause. And this is, again, just showing that lupus patients have higher risks of hip fractures. You see how their curve is going up quicker in the red than those without lupus. And by all means, lupus patients have about a 62% increased risk of hip fracture, and prednisone and steroids is a major contributor, which is why we want to try to minimize that. And the other thing we have to deal with aging, which is really important, I'm sure Dr. Lieber will talk about some of this, is that a lot of social determinants increase with age. social isolation. And I think Cherie mentioned this, lack of transportation. And what about when you have to go from, commercial insurance to Medicare? That can be a nightmare, right? All of a sudden you can't get your Part D medicines, or you can't have access. You're on a fixed income. You've got decreased mobility. So we have to address these if we want patients to live well through the lifespan. And so the way I think of things when I see patients is we have to address these buckets. The first is we want to make sure lupus disease activity is under control. And fortunately, it tends to get better over time, and it tends to get milder over time in general. We have to manage these other comorbid conditions, and primary prevention is the way to do it. And we have to pay attention to social determinants of health. So in my office, in my Autoimmunity Institute, we have a team of behavioral health consultants and pharmacists and social workers and dietitians, because that kind of management becomes critically important, not just the medications that we give. So, but with all of this said, people are doing better with lupus, and the future is bright, so you can all live a very healthy life across the lifespan. So I'm going to end there. I will stop sharing.
Wow, thank you, Dr. Manzi. As I was reviewing questions, I feel like you covered a big chunk of a lot of our guests and attendees and audience questions. I'm so excited now to introduce Dr. Sarah Lieber. She is an attending rheumatologist at the Hospital for Special Surgery and an assistant professor of medicine at Weill Cornell Medicine in New York. Her research focuses on enhancing health-related quality of life in adults with systemic lupus erythematosus across the lifespan. Her research on frailty and aging in lupus has been supported by the Rheumatology Research Foundation, the National Center for Advancing Translational Sciences, and the National Institute on Aging, another powerhouse to come to us and share. Dr. Lieber, you have the floor now.
Thank you so much for that really kind introduction. And I'm so pleased to follow Dr. Manzi's talk, because I think there are a number of important concepts that I'll reiterate in my talk, and also talk about some tips to conclude for healthy aging. So let me just try and share my screen. So hopefully everyone can see that.
Yes.
Thank you. So thank you again. I'm really pleased to speak tonight on aging well with lupus, and I'd like to thank the organizers for emphasizing this topic, which is of great importance. I don't have any disclosures per se, but would like to acknowledge the funding that I've been fortunate to receive from the NIH and other organizations to support some of the research that we've been able to conduct on aging in adults with lupus. So, as I'm sure many in the audience are aware, lupus can be associated with a variety of symptoms that occur due to the impact of lupus on different organs. As people with lupus age, it also can be helpful to keep in mind additional considerations that tend to arise. And as Dr. Manzi mentioned, sometimes it can be hard to disentangle the relative contributions of lupus itself from other aging-related factors. This evening, I'll orient the discussion around the 5Ms framework, which was developed by geriatricians to help recognize and address a number of aging-related considerations, many of which can have unique implications in people with lupus as they get older. The first of the 5Ms, as you'll see here, is mind, and cognitive dysfunction, as Dr. Manzi already mentioned, can be an important consideration in people with lupus as they get older. The next is mobility, and certainly people with lupus can experience limitations in physical function and mobility as they get older. The next is medications, and polypharmacy, or use of multiple medications, is something people with lupus also can face as they get older, as Dr. Manzi highlighted. The next is what matters most, which really highlights the importance of taking into account the personal goals and preferences of people with lupus as they get older. And finally, there's multi-complexity, which refers to what can be the really complex life circumstances of getting older, including multiple chronic conditions and social aspects such as loneliness and social isolation. All of these things are important to keep in mind. And of course, the aging experience of every individual with lupus is unique and quite different. I would add that while there's emerging research on aging with lupus, a lot of what we tend to know is derived from studies of younger people with lupus and older adults in the general population, though our group and others are working on discovering more about the aging experience and how we can tailor treatment recommendations to older adults with lupus. With regard to cognitive dysfunction, an estimated 4 in 10 adults with lupus show signs of cognitive dysfunction. Common symptoms can include memory impairment, attention deficits, challenges with language, and difficulty with planning and reasoning. And it's important to recognize that older adults with lupus tend to report worse cognitive symptoms than older adults with other rheumatic and musculoskeletal conditions based on some of the available research, really underscoring the importance of recognizing cognitive dysfunction and trying to manage it. Multiple factors can affect cognitive dysfunction in aging adults with lupus. It's believed to be driven by multiple factors. Some are lupus related, such as current or previous impacts to the central nervous system from lupus, and others are more general or lupus adjacent. And some of these factors can really be accentuated in the course of aging. And as I mentioned earlier, and as Dr. Manzi mentioned, it often can be difficult to disentangle the effects of lupus and other aging-related factors as they relate to cognitive dysfunction, really underscoring the importance of a thorough workup and involving members of the interdisciplinary team and one's own intuition in investigating these factors. With regard to mobility, nearly 7 in 10 adults with lupus report that lupus negatively impacts their mobility. Contributing factors can include joint pain, fatigue, low muscle and bone quality, and comorbid conditions. And once again, it's important to recognize that limitations in physical function can be present both in younger and older adults with lupus, underscoring the importance of recognizing some of these factors early and working with them as people age. With regard to polypharmacy, more than 7 in 10 older adults with lupus take 5 or more medications based on some of the available research studies, while more than 3 in 10 take 10 or more medications. So people can be on quite a few medications in lupus in general and as they age. And multiple factors based on the available research tend to predispose to polypharmacy, including older age, longer lupus duration, higher disease activity, and steroid or immunosuppressive medication use. And often it's very important and in fact necessary that people with lupus are taking multiple medications as they get older. With that said, we know from the available research that polypharmacy can increase the chances of experiencing unwanted health outcomes, such as medication-related hospitalizations in adults with lupus. So it's important to readdress one's medications periodically with one's rheumatologist and other members of the medical team. I'd like to talk for a moment as well about frailty. Many of us sort of have an intuitive sense of what frailty is based on our own life experiences, but in an emerging body of research in adults with lupus, it tends to refer to a syndrome of decreased physiologic reserve that's defined either as an accumulation of health deficits or based on several criteria, including weight loss, fatigue, weakness, slow walking speed, and low physical activity. And frailty, according to that second definition that I mentioned, is defined by the presence of 3 or more of these 5 criteria. And research on frailty really has been a focus on some of the work that we're doing in adults across the lifespan, including in older adults. It's important to recognize that nearly 3 in 10 adults with lupus are frail. In fact, some studies have shown higher prevalences, and this frailty prevalence actually exceeds the prevalence of frailty in older adults in the general population. And individuals with lupus who are frail are more likely to experience lupus-related organ damage, decreased quality of life, emergency department use, and hospitalizations. And as I mentioned, frailty can occur both in younger and older adults with lupus, underscoring once again the importance of recognizing it and trying to mitigate it early. Mobility limitations, polypharmacy, and other separate but related factors such as chronic inflammation and sarcopenia, which refers to low muscle mass and quality, can contribute to frailty, which is really an emerging concept in lupus, and other chronic conditions that will gain importance as we accumulate more data in this area. It's important to take into account personal goals and preferences in considering treatment decisions in lupus. This can be particularly important with aging, as, for example, comorbid conditions become more prominent, though it's certainly not unique to aging individuals. I'm not aware of any research studies that have examined treatment preferences specifically in aging adults with lupus, but trust in the medical team and desire to maintain quality of life and physical function have emerged as priorities among adults with lupus in general, and they're certainly of even greater importance in older adults. And in our research, we've found that aging adults with lupus have different perceptions of their lupus trajectory as they age, and this likely impacts personal goals and preferences. Multimorbidity, meaning the presence of 2 or more chronic conditions, increases with age in people with lupus. And at all ages, people with lupus have more chronic conditions than people without lupus. And this is true. This is true whether multimorbidity is defined by 2 or more conditions or 5 or more conditions. And examples of other chronic conditions that are common in people with lupus in general and as they get older include high blood pressure, back pain, and low blood counts, some of which Dr. Manzi has already mentioned. And the presence of multimorbidity has important implications for overall health and well-being and health-related quality of life. In addition, nearly 1 in 3 adults aging with lupus report that they're socially isolated, and close to 4 in 10 report being lonely. We've done some work in this area and asked people about their experiences of getting older with lupus, and we've found that social isolation tends to occur as a consequence of a number of factors, one of which can be limited social networks, but another of which can be behavioral adaptation to lupus disease manifestations, meaning people sometimes share that because of the fatigue and joint pain that they tend to experience in the context of lupus, especially as they get older, they may choose not to go out as much with friends or loved ones, which can contribute to social isolation. We've also done some surveys with older adults with lupus and found that adults aging with lupus who report being lonely and socially isolated are more likely to experience more severe pain, depression, disability, as well as frailty. On the other hand, it's encouraging that individuals with greater social support experience less pain, depression, disability, and frailty, really underscoring the importance of social engagement as people with lupus get older. Ultimately, early detection is valuable in addressing aging-related syndromes in lupus. They don't occur exclusively in older adults with lupus. Some of the factors we've mentioned, like cognitive dysfunction, mobility impairment, polypharmacy, and loneliness and social isolation, can arise in adults with lupus really at any age, and early recognition can facilitate timely introduction of treatment options to promote healthy aging. I would echo really what Dr. Manzi said earlier, in the sense that the experience of aging with lupus is obviously quite unique to every individual, and tips for healthy aging should be individualized accordingly. With that said, I think the overarching theme is that multimodality treatment is key to mitigating aging-related syndromes in lupus. You know, one important aspect of this, as Dr. Manzi has already mentioned, is addressing contributing factors. For example, disease activity or some of the comorbid conditions that I've mentioned and that she's mentioned that tend to occur in people with lupus when they're younger and may increase as they get older. Another really important aspect of multimodality treatment is physical activity. So physical activity is typically safe and well tolerated in adults with stable lupus. And exercise has been found in a number of studies to decrease fatigue and improve mood, physical fitness, and quality of life, with the caveat that few studies have focused specifically on physical activity and exercise in older adults. the guideline recommendations that are available from the CDC and the WHO for older adults and people with chronic conditions include at least 150 minutes of moderate intensity physical activity per week, at least 2 days of muscle strengthening activities per week, and activities to enhance balance. And these recommendations are also important in people with lupus as they get older. With that said, of course, it's important to remember that discussion with your rheumatologist, often a physical therapist, can tailor these recommendations to meet individual needs, especially if one has comorbid conditions or active lupus that might impact the types of physical activity that one can do. Healthy diet is also a cornerstone of remaining healthy as one gets older with lupus. I wish that there were more evidence on how we can tailor healthy diet to those with lupus, especially those who are getting older. You know, there's fairly limited information available to specific to people with lupus or older adults with lupus, but it's certainly an important aspect of self-directed care. With that said, maintaining a balanced diet and eating calcium and vitamin D rich foods can promote bone health, which often can be compromised in older adults with lupus due to chronic glucocorticoid use and other factors. Another important aspect of remaining healthy as one gets older with lupus is social engagement. There are a number of different forms of social engagement, as many of the audience, I'm sure, are already aware, that can be very helpful as one ages with lupus, including community groups and support groups, which may be, particularly relevant and impactful to those with lupus. And certainly other activities like volunteering and spending time with friends and loved ones can be extremely important. Another important aspect of remaining healthy as one gets older with lupus is cognitive engagement. Some examples of important aspects of cognitive engagement can include cognitive rehabilitation and self-directed activities like developing memory aids or engaging in mentally engaging activities. Cognitive rehabilitation really refers to a program often with specialists such as occupational therapists and others that can involve retraining and strengthening cognitive skills, coming up with additional strategies to make up for cognitive deficits that one notices, and potentially even environmental modifications to improve one's experience cognitively. And I'd like to really conclude with the idea that interdisciplinary teams can support aging adults with lupus. First and foremost, the team can include caregivers and loved ones to the extent that people have those individuals available, rheumatologists and other medical specialists, and of course, interdisciplinary health professionals like physical therapists, social workers, and others. And while the extent to which aging adults with lupus decide to involve caregivers and loved ones in their lupus journey is, of course, deeply personal, research has highlighted the importance of caregiver relationships to many people with lupus. And while caregiver relationships are not unique to older adults with lupus, they can be particularly important in people with lupus as they age and face some of the cognitive dysfunction, mobility impairment, and other chronic conditions and limitations that we mentioned. And with that, I'd like to conclude and hand over my screen so that hopefully we have some time to continue this discussion together. Thank you so much.
Wow, what great presentations. I found myself as I was looking at the questions in the background, every time I brought up one, you all seemed to answer it. So, in the sake of time, I want to really hone in on Dr. Lieber and Dr. Manzi. If Victor and Cherie want to come back, everybody can turn on their screens. And I see a lot of our questions have been covered, blanketed, but I would love for each of you to leave us with some final pieces of information or nuggets from your area of expertise. I want to start with Cherie and Victor. Please think about the relationships. I heard that it needs to be a multiple or multifaceted approach to aging with lupus, inside and out, and different factors need to be considered and honed in on. When you think about the journey you're on and what you found to be successful as someone who's made it to 36 years, what is one approach you want to instill in others? I've even noticed there was a question, Cherie, about how did your husband feel in this journey? Please leave a nugget for people to take away, knowing these approaches we've just heard.
Um, I'm going to say hopeful. I want people to have hope. A cure is coming. We know from Dr. Lieber and from Dr. Manzi, they are doing great, great work. So we
Hmm.
are hopeful. My husband in the very beginning, I had to take him to the doctor with me because
Yeah.
he likes to encourage me. Come on, you can get up, you can do it. And I'm like, I can't get out of bed. Everything on me hurts, or whatever the case may be. So it wasn't until my rheumatologist started to talk to him and explain, and he really got an understanding of lupus, was he then able to kind of join me on this journey instead of fighting against me on the journey.
Okay.
Um, so education is so very important for ourselves, our caregivers, and those that are partnering us on this journey, but also having hope. I get up every day just having hope.
That's beautiful. Victor, what about you? What pearls or gems would you like to leave based on your experience?
I would say for those who are newly diagnosed, I know it's gonna be rocky the first few years because you're not gonna because this is very unexpected. Your lifestyle is going to change, and your body's going to change. But I would say, just like Cherie said, be optimistic and hopeful that things will get better. I mean, you'll adjust to kind of like your new body, and you'll know about what kind of limits you can do with your body and mind. So I would say just yeah, be optimistic that your journey will get better over time and get
Thank
easier.
you. I'd like to go to you, Dr. Manzi. You've had some amazing, facts and statistics for us. I can't wait to rewatch these and look through this again. As an expertise, especially looking at the clinical aspect of aging with lupus, I liked how you laid out the big buckets to consider. What do you think from this point on people should definitely walk away knowing as they get older? And we see that many of us can live a long time with lupus. What would you like people to know?
Yeah, so I think of some points, and again, I want to say this, everybody is individual and different. So I'm giving you generalities. In general,
Yes,
childhood onset lupus tends to be more active, right?
yes.
More kidney disease, more brain involvement, definitely, right? Mature onset lupus over the age of 50 tends to be milder. It's a little different. It has a different flavor for it. But regardless of when you develop lupus in that spectrum, disease for most people improves over time because of better treatments, more informed patients, and I think just better healthcare and recognition of lupus in general. So that's all good. But as we age, we have to be thinking not just about our lupus, but our general health, our
Yeah.
cancer screenings, right? Our heart prevention, because those tend to be more commonly problematic in lupus. So we have to be even more diligent about managing those potential outcomes.
What about dementia and Alzheimer's? Is this something we should have on our radar as well?
We do, we do. I mean, I think we all think about that,
Yeah.
but for lupus, to me, what we have found is most of it tends to be from a cardiovascular perspective. You've heard
Okay.
of multi-infarct dementia, or it
Yeah.
tends to be like like multi little strokes, and that has to, again, with the heart health and your vascular health, your blood pressure, your cholesterol level, those kinds of things become important. And remember, sometimes forgetfulness can be fatigue. There's other reasons for why you feel your memory isn't as good.
Yeah.
Dr. Lieber's got to be an expert on that, but
Yes.
not everything is, oh my gosh, this is my lupus affecting my brain, because some of those things happen in general. So
Mhm.
I just want people to be hopeful. And I think Dr. Lieber gave great examples
Yes.
of, lifestyle changes. So as I said, the future is bright. It's just understanding. And remember, again, not every joint pain is your lupus, and not every fatigue is your lupus because of the aging effects that happen to all of us.
Mm-hmm. Thank you so much, Dr. Manzi. And Dr. Lieber, we'll close out with you for your expertise. What really stood out to me and that what really echoes from our community is the isolation. And as you get older, sometimes you look around your circle and you do feel alone. You might not have a network of people. But I was glad to hear that you should still, be active and exercise and, be proactive. What's your expertise and your nuggets you'd like to leave with us?
Yeah, I think that that's such an important point. I think that people with lupus in general, and as they get older, can find themselves socially isolated or lonely for some of the reasons we mentioned, either because there aren't a lot of friends or loved ones around or available, or in some circumstances because the joint pain or fatigue or other symptoms they experience related to lupus or other aspects of getting older can leave them in a situation where they find that they can't go out as much. So I guess I would just say, to the extent that people are able, recognizing, as Dr. Manzi mentioned, that everyone's journey is unique, to
Mm-hmm.
find ways of enjoying oneself with others and
Yeah.
volunteering, participating in some of the support groups that are available. These are ways that one can enhance one's experience and improve, quality of life as one gets older.
Thank you so much. And I do want to take a moment and just shout out our care and support services team. They are amazing. As you all were speaking, I was so delighted to reflect and think about what we're doing behind the scenes. And we do want to let you all know that we're here for you and we have a lot of support. We're here to work with you one-on-one. We have some specialized support groups, one for caregivers, one for men, one for youth. And the list goes on. We have over 70 that are active and available for you. So you can get in where you fit in and know that this is your tribe. And our team is here to help you. We offer education and services. And a lot of the things that were suggested today, you can find right here in our department. So we'll be happy to help you. Just reach out. We're just a phone call, as you can see away. Here is our national email. Please explore our website, lupus.org, to learn more about lupus. And then connect with us on social media. This is another way to stay active. You might not be able to go out and about, but you can meet people online. Our handles are here. We're on Facebook, IG, or Instagram, and X. And then if you want to stay in the loop and get updates and notifications, please go to lupus.org/subscribe, and you'll get all of our emails and stay in the loop. And we would love for you to do that. So we really pride ourselves on educating and supporting our community, and we'd love to do it. So I'd like to thank everyone for attending. I hope you found this time enjoyable, informative, and enlightening. And I wish you so much joy for the journey and hope. I'm sitting here 25 years later after a horrendous experience early on. And as you can see, Victor and Cherie are testaments to that. So you can live a very long and happy quality life. You might have to make some adjustments and ask for help and all of that good stuff, but don't be afraid, to reach out. We're here for you. So thank you so much. Thank you again, Dr. Lieber, Dr. Manzi, Victor, and Cherie. Thank you so much. We just thank you. We can't thank you enough. I also want to, let me pause a minute. I also want to let you know we're doing our last webinar of 2025, and we've saved a very interesting topic that was mentioned quite a bit last year. And this is going to be Lupus and You After Dark. So mark your calendars for October the 16th. And you're going to tune into this webinar for a candid, empowering conversation filled with practical tips, expert advice, and real talk about navigating sex, intimacy, self-confidence, and doing all of this while you're living with lupus. So don't be afraid. We're going to do this after dark conversation. So please join us and reach out if you have questions. Have a good evening, everyone. Don't forget to take our survey. The code is here.